system at its best, where it is indeed the finest in the world, you want to look up close and personal at the medical miracles that save individual lives. The American system produces high technology and human innovation like no other healthcare system on earth.
This is actually the bread and butter of our work, is really a balloon with a stent on it.
State-of-the-art self-cleaning stents like these went from Dr. Young's fingers into 73-year-old Xian Shaw Kung's chest just a week before Kung went out walking with his grandchildren.
Hi, Mr. Kung. I see you.
Once Kung's cardiologist decided he needed an angioplasty and called Dr. Young, everything moved quickly.
I have consultation on Tuesday, and then I have the angioplasty done on Wednesday.
That's the way it's supposed to be in American health care. You get what you pay for. In this case, Kung got the best the world has to offer because he has good health insurance from his employer and Medicare.
So it's all covered 100%.
An estimated 43 million Americans have no such coverage. Their plight is what led the World Health Organization to rate American health care no better than 15th to 37th best in the world, depending on how you read the fine print.
I think everybody was shocked for sure.
That was the first reaction. But Professor Scheffler says the WHO's wake-up call led him to this judgment about America's healthcare system.
I think it deserves its rating as not even close to the top 10.
Construction worker Rick Gudgel and his family have no insurance.
2 of them at 19?
Rick and his wife earn too much for California's subsidized medical coverage, and not enough, they say, to cover the costs of their own insurance policy. So, like 1 out of every 6 Americans, they have lived at risk. The gamble paid off until just before last Christmas, when 5-year-old Colton Gudgel accidentally stuck himself in the eye with a steak knife.
I saw him holding a knife and holding his eye, and that makes your blood run cold.
Even as they headed for the hospital, the Gudgels juggled 2 fears, one about Colton, the other about their insurance problem.
You know, the whole time, you know, you're thinking, are we going to get help? Because we didn't have insurance.
Saving Colton's eye cost the Gudgels more than $30,000. They'll be paying it off a week at a time for years. And they say they still can't afford insurance, and so they skimp on doctor's visits for their kids.
I worry about that a lot. Like, you know, just doctors can find things that you just normally wouldn't expect at just a regular health checkup. And I feel that my children are missing out. And I worry about if they are really okay. They look and they act healthy, but are they really?
When the World Health Organization low-rated U.S. health care, it had people like the Gudgels in mind, the more than 40 million Americans the system underserves. And the report noted Americans pay far more for health care than any other people on earth, more than double what the Canadians pay for a system that guarantees everyone free lifetime medical coverage, and by most broad-scale measurements, delivers Canadians longer and healthier lives.
So how good is the health care in a country that provides cradle-to-grave coverage? Dave Marish visited our neighbor to the north to find out.
Canadian health care outdoes America right from birth. In the U.S., 17 women die out of every 100,000 births, compared to Canada's maternal death rate of just 6 out of every 100,000 live births. In America, the infant mortality rate is 6.75 deaths in every 1,000 live births. In Canada, the number is 4.88 per 1,000.
20 and a half.
And in Canada, children are better immunized against disease than in the United States.